Welcome to this training session on understanding and interacting among Ohio's population with disabilities. The overview of this layout will go through the demographics, type of disabilities, etiquette, and more. The purpose is to prepare you to be more effective with communication, interaction, and designing programs for children and adults with disabilities. The definition of disability is a physical or mental condition that limits a person's movement, senses, or activities. Disability is an umbrella term covering impairments, activity limitations, and participation restrictions. Overcoming the difficulties faced by people with disabilities requires interventions to remove environmental and social barriers. Remember, people with disabilities have the same health needs as non-disabled people. They also may experience a narrow margin of health, both because of poverty and social exclusion. There are many types of disabilities, such as those that affect a person's hearing, vision, movement, thinking, remembering, learning, communicating, mental health, and social relationships. Disabilities can affect people in different ways, even when one person has the same type of disability as another person. Some disabilities may be hidden or not easy to see. There are over 1.5 million people in Ohio with any disability, which is about 16% of the total population. There is a little over 100,000 children with any disability, which is about 6% of total Ohio residents. 23.8% of people with disabilities have a family income of less than federal poverty level. Persons with a disability are likely to have limited opportunities to earn income and often have increased medical expenses. Disabilities among children and adults may affect the socioeconomic standing of entire families. Although the Americans with Disabilities Act assures equal opportunities in education and employment for people with and without disabilities and prohibits discrimination on the basis of disability, people with disabilities remain overrepresented among America's poor and undereducated. These barriers contribute to discrepancies in wealth and socioeconomic opportunities for persons with a disability and their families. Individuals with a disability and their families are at increased risk for poor health and quality of life outcomes when their disability status affects their socioeconomic standing. Research on disability and healthcare suggests that individuals with a disability experience increased barriers to obtaining healthcare as a result of accessibility concerns, such as transportation problems. There are many etiquettes for communicating with people with disabilities. First, you should speak directly rather than through a companion or sign language interpreter who may be present. You may offer to shake hands when introduced. People with limited hand use or an artificial limb can usually shake hands, and an offering the left hand is an acceptable greeting. Always identify yourself and others who may be with you when meeting somebody with a visual disability. When conversing in a group, remember to identify the person to whom you are speaking to. Treat adults as adults. Address people with disabilities by their first names only when extending that same familiarity to all others. Never patronize people in wheelchairs by patting them on the head or shoulder. Do not lean against or hang on someone's wheelchair. Bear in mind that people with disabilities treat their chairs as extensions of their bodies, and so do people with guide dogs and help dogs. Never distract a work animal from their job without the owner's permission. Listen attentively when talking with people who have difficulty speaking and wait for them to finish. If necessary, ask short questions that require short answers or a nod of the head. Never pretend to understand. Instead, repeat what you have understood and allow the person to respond. Place yourself at eye level when speaking with someone in a wheelchair or on crutches. Tap a person who has hearing loss on the shoulder or wave your hand to get his or her attention. Look directly at the person if the person can read your lips. Try to face the light source and keep hands, cigarettes, and food away from your mouth when speaking. If a person is wearing a hearing aid, don't assume that they have the ability to discriminate your speaking voice. Never shout to a person. Just speak in a normal tone and rate a voice. If the person has trouble understanding what you are saying, try rephrasing the sentence. Relax. Don't be embarrassed if you happen to use common expressions such as see you later or did you hear about this that seems to relate to a person's disability. When a person is or becomes disabled in the workplace, he or she may need a reasonable accommodation in order to remain active in the workforce. With an effective, reasonable accommodation, an employee with a disability can perform the essential functions of the job and enjoy the same benefits and privileges of other non-disabled employees. An interactive dialogue is an opportunity for the employer and the employee to have a discussion. The parties can discuss the essential functions of the job and to take a look at how a person's disability may impact the ability to perform those functions. The employer may need to gather more information concerning the nature of the disability and the individual's functional limits in order for the parties to identify an effective accommodation. Fortunately, there are extensive resources out there to assist. A free resource that is out there is the Job Accommodation Network, which assists employers, people with disabilities, and others to improve the employability of people with disabilities. People with disabilities are less likely to engage in regular physical activity than people without disabilities, yet they have similar needs to their health and prevent unnecessary disease. People with disabilities should first consult a physician before beginning a program of physical activity. Social support from family and friends has been consistently and positively related to regular physical activity. It is important to ensure that environments and facilities conducive to being physically active are available and accessible to people with disabilities. Many modifications are often simple and inexpensive. You may only have to move an activity to an accessible room with a doorway that is wide enough for a wheelchair, or you can show an individual how to perform an exercise differently or with adaptive equipment. Together with the individual with a disability, decide what is needed. It is important to keep the lines of communication open. A person beginning a physical fitness program may not know what to expect. He or she may feel self-conscious about exercising or concerned about getting hurt. He or she will look to you for assistance, guidance, and reassurance. Ask people with disabilities about their needs and expectations. Include them in planning, implementing, and evaluating your program. Encourage feedback and listen to their concerns. No one sees the obstacles to access like someone who must overcome them. For the Children's Hunger Alliance, this means programs like the Coordinated Approach to Childhood Health should be able to be modified for children with disabilities. Think creatively and involve the parents and guardians in the process to help. There are many places that can help with this, including the National Center on Health, Physical Activity, and Disability, which is available to facilitate with fitness techniques and methods for adapting exercising for people with disabilities. Family and caretakers are the #1 resources for people with disabilities. There is a financial burden on getting health, education, and social services, buying devices, medication, etc., which leads to poverty. Working with families with disability, you need to know that the day-to-day strain of providing the care needed leads to exhaustion, fatigue, and possibly frustration and anger. The stress can negatively affect the caregiver and persons with disability. There are statistics that show many caregivers skip meals. Knowing facts like this can help improve the education that the Children's Hunger Alliance offers. To conclude, here's some advice on how to behave toward anybody with a disability. To be politically correct, here are some examples. Don't say special needs child. Do say child with special needs. Don't say autistic child. Do say child with autism. Don't say Down's kid or Down syndrome child. Do say child with Down syndrome. Don't say disabled person. Do say person with a disability. Don't say mental retardation or mentally retarded. Do say a person with an intellectual disability. Our final suggestion is to treat any person with a disability as you would treat your own friend. This concludes our course on cultural competency training for the disability population in Ohio. It is not, however, the end of your learning. Read more information on disabilities you do not have experience with. Don't be afraid to ask people with disabilities questions, and get to know them on a personal level because they are people just like us. If you are interested in reading further, here are some additional resources. Thank you for your time and best of luck.